In this week's video, we're looking at depression. We're going to look at what it is, we're going to look at how it differs from anxiety, and we're going to look at what it feels like to have depression. This video is all about information on depression to help you recognize those symptoms or to recognize those symptoms as someone else that you know. So to begin with, when we talk about depression, first of all, it's important to understand that it's not obvious just by looking at someone to tell that they're depressed, because inside their mind, you don't know what's going on. There could be thousands or hundreds of thoughts that are going on. Now, depression is much more than feeling worried or upset about something. It's far more complex, and it's different to anxiety too. Anxiety is usually grouped with different conditions such as phobias, generalized anxiety disorder, or panic disorders. Now, you can get some forms of anxiety with depression as well, but it does come with many other symptoms too, which we're going to discuss in this video. Now, if you are someone who suffers with anxiety, I do have a video on that topic too. Feel free to check it out if you think it might be helpful. I'm going to leave a link to it up here and in the description below. So now let's talk about what you may feel if you're suffering from depression. First of all, please do remember, depression is very specific to yourself. You might feel something else, other people might feel something else, and it comes in different levels from mild to severe. Now, I'm going to work through the different types of symptoms and different types of thoughts that you have if you are suffering with depression or symptoms of it. And if you have any of these, I would highly recommend that you speak to a healthcare professional as soon as possible. So when you have depression, you may feel sad, and this kind of sadness starts to get in the way that you live your life. For example, you might feel unmotivated. You can't be bothered to do things that you used to get pleasure out of. For example, your hobbies, your activities, seeing friends. And you may even find it difficult to make decisions, to make commitments, to get things done. And this low mood may tend to last longer than is normal. It might last more than a few days, it might last a few weeks, it might last a few months. So this is something that starts to happen when you have depression. Another thing is also to remember, if this is lasting for 2 weeks or more, you really need to speak to a healthcare professional or speak to one of the charities, which I'm going to leave links to in the descriptions below. And also speak to your friends, speak to your family, make them aware, let them know how you're feeling. This is really important too. Now, another sign of depression is that you could have a lingering feeling of hopelessness or feeling helpless, and you might even cry a little more than you usually do or be a bit more tearful than you usually are. And this can be brought on as a result of feeling guilty, or if you lose a loved one, this can really happen as well. Also, people who live on their own are a lot more likely to feel like this, but it's really important to remember, if you're having any of these sort of feelings, you've got your healthcare professional. That's what they're there for. They're there to listen, they're there to speak to you. So speak to your healthcare professional. And another thing that I want to discuss is having low self-esteem, so feeling worthless or not being as confident as what you used to be. So these are things that you need to look out for. Now, if you do suffer from low self-esteem as well, I do have a video on that topic, which you might find helpful. I will leave links to it up here and in the description below too. So previously I mentioned that depression has different severities, so you have mild to severe. So what we've been speaking about so far is more the mild to moderate kind of symptoms that you'd have. But when we go into more severe thoughts, we're talking about negative thoughts, we're talking about thoughts of self-harm, suicidal thoughts, thinking about self-harm, planning things. These are the more severe forms of depression. If you're having any of these sort of negative thoughts, any thoughts of self-harm, any negative thoughts, any plans, anything like this, please do speak to a healthcare professional urgently. Like I said, I'm going to leave loads more information in the description below as well for helpline numbers, charity numbers, emergency contact numbers. So if you do need that support, it is out there for you. So I think it's really useful for you to be aware of this, even if it's not for yourself, if you're watching it for someone else. If you're noticing these changes in a friend, in a family member, you know what to do, you know where to signpost them to for that help and support. Now, moving on to physical signs of depression. These are usually not very obvious, and sometimes they take a bit of time to develop as well, but it's good for you to be aware of these as well. We're going to go through them. So for example, if you have depression, you may have a lack of energy. This is quite common. You might have a lack of energy, a lack of motivation to do things, and this can be as a result of certain factors. For example, you might not be sleeping well, you might be waking up really early, so you're not getting a good 7 to 8 hours of sleep that will require good quality sleep to make you feel energized and woken up, and as a result of this depression, it's causing you to feel tired all the time. And on top of that, you might also start feeling a lot weaker than usual, and you might start feeling aches and pains in places that you never used to get. Now, another thing as well to bear in mind is you might find it difficult to go to the toilet as well because your eating habits have changed. For example, you might be eating more or less as a result of this depression. So let's take, for example, that you're eating less, and as a result, you're going to have less energy, and as a result of the lack of sleep as well, you're going to have even less energy, and you might find it hard to have conversations with people because you just don't have the energy to speak, to bring up topics, to bring up conversation with people, and as a result of this, you end up isolating and not speaking to people and not socializing to people. So I'm just trying to give you a little outlook of how it all links together. And for ladies who have periods, sometimes a physical sign from depression can be that you start to miss your periods, or they start to become a bit more irregular or lighter than usual. So I thought it was important to discuss these physical symptoms because letting them get worse can sometimes be a sign that the depression is getting worse. So it's really important, if you're having these sort of thoughts, if you're having these kind of physical symptoms, or if you know someone who's having these, then speak to a healthcare professional, or get them to speak to a healthcare professional. It's really important that this is looked at sooner rather than letting it get worse. And I know sometimes you might not be up for it. All of us are like this. Sometimes you just can't be bothered doing something, but please don't leave it. There's so many people that you can speak to. Like I said, I'm going to leave loads more details in the description below for various different charities and emergency lines that you can just speak to. You don't have to physically go in. Sometimes you can just pick up the phone and speak to someone. Can make such a big difference. So the next thing I want to discuss are the triggers of depression. If you have a family history of depression, you might be more likely to get depression. Another thing I wanted to discuss as well is sometimes there's no obvious cause for depression. It might just be your personality type that makes you more vulnerable. So don't think of triggers like that either, like they're a cause, but I'm just making you aware of these. And sometimes depression can be caused by a stressful event. So for example, losing a loved one, or ending a relationship, or living on your own and being isolated and then becoming dependent on alcohol, for example. That's another trigger. And some people may have a long-term condition that they're struggling to cope with, and it's bringing their mood down, it's lowering their mood and making them feel low. And sometimes women have depression after giving birth, and this is known as postnatal depression. So whatever you think the cause might be for the depression, I want you to know that you can make a recovery, you can get back to normal, back to what you were before. But you need to make sure that you're looking out for these triggers, you need to make sure that you're looking out for the symptoms that we spoke about, and you need to make sure that you seek help. You seek help from a medical professional. Your healthcare professional is there to help you. That's the most important thing that I'm going to keep on saying in this video, because I want you to keep thinking of that. Now, the next thing that I wanted to include in the symptoms of depression is social interactions, because sometimes when you have depression, you might not feel like hanging out with friends or family, or even going to work or college. Sometimes you just don't want to do these activities. And this might be because you find people irritating, or you just can't tolerate being around them, and this results in fewer activities and difficulties at home or at work or with colleagues. And people may start to notice these changes in your behavior, or if you know someone who you've noticed these changes in their behavior, speak to them, talk to them, ask them how they feel, ask them what's going on, lend them an ear, lend them a shoulder, listen to them, let them unleash on you and tell you what's going on. This can be really, really helpful. And this is because someone with depression will really thrive on the knowledge that someone out there is wanting to listen to them, listen to what's going on with them, and really take an interest. That's why it's so important that you stay in touch with family, you stay in touch with friends, you communicate with people either via phone or in person, just to help with this. And just by letting them know that you're there for them, just by sending them a text or just ringing them out of the blue, can make such a big difference. That's what friends and family are there for. And sometimes you might even be able to give them a nudge in the right direction if you feel like they should be speaking to a healthcare professional, they should be getting more help. Now, I haven't spoke about grief, postnatal depression, or bipolar disorder. These are different types of depressions with different types of symptoms. But if you do want a specific video on these, I'm more than happy to do them. If you leave a comment below, I'll get back to you. And I think the most important thing from this video is, remember, if you're having any of these sort of symptoms that we've spoke about, we've gone through them all one by one now, you know about them. If you're having any of these sort of symptoms or having any doubts at all, speak to your healthcare professional. That is the most important thing. And like I've been saying throughout this video, that's all I want you to do. I want you to remember these signs and symptoms, and if you're having any of them or any of these sort of thoughts, or if you're noticing anything like this, speak to your healthcare professional. That's what they're there for, and they're there to help you. And I know at the start of the video I said the 2-week guide if you're having the low mood for 2 weeks or more and it's continuing, but please remember this is a rough guide. You can speak to your healthcare professional sooner. 2 weeks is just a rough guide. So if you want to speak to someone sooner, by all means, please do that. And I'm going to leave loads more information, like I said at the start of the video and throughout the video, in the description below, to charities, to helpline numbers, and to more resources that you might find helpful. And another important topic that I wanted to discuss with you as well is when you're speaking to your healthcare professional, be open and honest with them. Really tell them how you're feeling. Really tell them what's triggering it, what's making it worse. Tell them everything that's inside you. Just open up to them. And I know it's a lot easier said than done, but this is generally the best way for healthcare professionals. For myself, for example, when I speak to a patient who's open to me and is telling me everything I need to know, it's a lot easier for me to give them the right help that they need. And similarly, if you know someone and you've noticed that their mood has dropped, you've noticed these changes, and that's probably why you've come to watch this video, to get more information, try your best to nudge them in the right direction to the healthcare professional. And sometimes they might not want to, they might not believe what you're telling them. So also another good idea is, if that is the case, speak to the charities. There's loads of charities, which again, I've left information in the description below to them. They can give you some really good advice as well. So that's the end of this week's video. I really hope that you found this information helpful. I've tried to make it as simple as possible so that you know about the signs, you know about the symptoms, you know about the physical symptoms and what to do. As I always say, always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.